One of the commonest reasons for female infertility is PCOS or polycystic ovarian disease. And lots of young women will have PCO. Now, PCO is of two types. One is where it's obvious the woman has PCO because she's obese, she's hirsute, has a lot of extra hair, and has irregular periods. So that's easy diagnosis. But there are lots of other women who are lean PCO, which means everything seems to be fine. Their periods are regular, they're not fat, they're not hirsute, but they still have PCO, and you only make that diagnosis by doing an ultrasound scan. So the point is that it's not always easy to make this diagnosis. And PCO patients have both pros and cons as far as IVF treatment. Now, lots of PCO patients will get pregnant with simpler treatment options, which is good news. Some will get pregnant with clomiphene, some will get pregnant with metformin medical treatment, but some will require IVF, but for some who don't get pregnant with any of these, they will require IVF. Now, that's good news and bad news if you have PCO and you're doing IVF. The good news is because you have PCO, you're likely to produce lots of eggs and therefore have lots of embryos. The bad news is because you produce lots of eggs, a lot of these eggs may not be very good quality, which means you may not get lots of embryos. And what's even worse is your risk of developing ovarian hyperstimulation is actually quite high. And this is a big problem, especially if you go to a junior IVF doctor who doesn't have much experience in treating PCO patients, because they get so excited when you're growing all these follicles, they keep on making you grow more of them. And then you end up with hyperstimulation, which can be a life-threatening problem. The good news is you go to a good doctor, you take treatment after the right diagnosis, you put yourself on metformin and myoinositol, and then you do IVF and you freeze all your embryos. Your chances of ending up with hyperstimulation are extremely low, and the chances of you having a baby after transferring your frozen embryos are extremely high. Just make sure you're well informed and find a good IVF doctor.